Hi, this is Kate Marie from the Slow Aging channel. Here I go again. Today I've got lots of things in store. I'm getting the back of my hands regenerated because I've noticed as I'm getting older that I'm getting lots of knocks and cuts on my hands. So the skin is very thin. So today we're doing a bit of laser work on the skin plus Platelet Rich Plasma injections, PRP. So while I'm getting my hands done, I thought I may as well get my neck and chest done as well. Same thing happens on your neck and chest. You start to get thinning of the skin, it becomes friable, and you lose support structure underneath. So I'm trying to regenerate a bit of the tissue on my neck and chest, or décollage as they call it. And lastly, because I'm starting to lose my hair, I've noticed here that I'm getting a loss of hair at the side of my head and also at the top. And it's for a couple of reasons. As you get older, you lose your estrogen. So it puts all your hormones out of whack. Plus, I was stupid enough to take too much testosterone at one stage. I was trying to go for sort of physical, enhancement, become like some sort of athlete. So I started taking all these testosterone supplements. So my hair fell out because they weren't being detoxed from my body properly. So I'm going to have a go at trying to stimulate my hair follicles to grow more hair. So yes, stay posted. We're in for a few needles. So that we've got enough platelets for these quite large parts of my body, Bruce is going to be spinning out some blood in a centrifuge.
These are Regen Lab PRP tubes.
You're using Regen. Why do you use Regen?
It's a very convenient system that produces high quality platelet rich plasma very easily with very little risk. Surely that's a flashback. Yeah, beautiful. So after we've spun our blood, it then looks like this. So what we have here is our red blood cells, and these are compacted down into a little nugget down at the bottom. Then we've got our gel separator. Then on the surface of that, there is a thin coat of platelets, which is our platelets. And then we have plasma here, which has some platelets in it, ranging to plasma that has very few platelets in it at the top. So I can just resuspend all of those platelets in that amount, and then we take the platelets from 10 mils of blood, and we now have them in approximately 5 mils. So that's a concentration of 2 to 1. But what I'm going to do is draw off approximately 1.5 mils off the top of this tube, and then resuspend the platelets in the 3 mils that are left. That way we take the platelets from 10 mils and then now suspend in 3 mils, so we have a concentration of approximately 3 times. So we've drawn off 2 mils of what we call platelet poor plasma. Then we're going to put the cap on here, and what we'll notice is that this clear fluid, which is quite clear in there, we'll now resuspend the platelets by inverting the tube, and then we can see that it now has a slightly opaque, slightly milky look to it. I'm not sure if that's obvious on the camera, and that's our platelets now suspended in there, and they're concentrated by approximately 3 to 4 times. Okay, so now I'm drawing up the platelet rich plasma, which has had the platelets resuspended in it, and I'm drawing that up in preparation for loading it into the gun. Oh, and you can actually see the little blebs of the PRP injected just into the surface of the skin where you want it there. Ideal, it's perfect. But if I was injecting filler like that, no. If I was using a hyaluronic acid filler, no, you wouldn't want that. But this is PRP, so it's just, but I couldn't physically inject it by hand just into the skin like that. I would either be under the skin, through the skin, or not far enough. It's very hard to do. I've also injected it just to inject quite a large volume, whereas when I did Kate's face before with the filler, we were injecting a lot smaller volumes. So far this morning we've used 86 shots, and each of those shots has 9 needle punctures. So we've done a total of approximately 750 needle punctures on Kate's on the kind of side of Kate's neck there, and we've put approximately 5 mils of PRP into that side of her neck and chest. And now we're going to do the other side. The injecting of the platelet rich plasma of the PRP into the skin, and you can see all the tiny little blebs on the skin where the platelet rich plasma is in the skin. Now this is the fraction we drew off the top to concentrate it, which is called platelet poor plasma, or PPP. It doesn't have any platelets in it, but it still has some wound healing capability and some antibacterial capability. So we use this as a wound dressing on the top. So what I'm using it for now is I'm just putting this on the top and I'm spreading it around. It will dry into a proteinaceous kind of coating, a bit like egg white, which has antibacterial and healing properties, and it also helps to clean the little marks of the blood marks off the patient's skin, rather than having to rub their skin with an antiseptic or something like that. So on Kate's skin this morning, we've used 165 shots, which equates to roughly 1,500 needle punctures, and from looking at her chest here, I can see out of 1,500 needle punctures, 1 bruise that's been produced there, which will be a little discoloration for a few days. So you can see just a little bit of discoloration, but that's pretty much the only bruise on her neck and chest after all of this has been put in, which is a remarkable thing, I think. You try and do that with a needle by hand, and you'd be black and blue. What I would then do over the top of this is I would use a silicone ointment as the final dressing. So I'm going to let this platelet poor plasma dry on there, and then I'm going to put a layer of silicone ointment on there, which restores the skin's barrier function and enables it to settle down and heal more quickly.